Scott, thanks for joining us today. This is a sort of a duplicate effort. We're both wanting to hear updates from Washington, D.C., from NHSA, and we're also wanting to continue to promote the Dollar per Child campaign that NHSA runs each year that we all support. We know that your work and the work of a lot of folks at NHSA are influenced by the funds that are raised through local agencies. So we're committed to supporting the raising of those dollars, and also really appreciate you coming on the phone with us to update us and share with us the things that are going on and how we can be better advocates for our Head Start organizations here in the West. So Scott, take it away.
Okay, great. Thank you, Ed, and thank you everyone who's on the call for participating, and really appreciate your great work on Dollar per Child, which is just critical to the National Head Start Association. Again, my name is Scott Groginsky. I know some of you, and I am the Senior Director for State Affairs at the National Head Start Association. And as I mentioned, the Dollar per Child effort is instrumental in helping us achieve the kinds of advocacy on behalf of Head Start children and families throughout the country. So we are deeply appreciative of your participation in that and help with it. So today I'm going to be talking mostly about my role as the Director of State Affairs, but also want to give a pretty brief federal update. There's a lot happening here, and also make a quick plug for our annual conference, which begins very end of next month. Thank you. Here is the details. It's at the Henry B. Gonzalez Convention Center in San Antonio, Texas. Our annual conference, which is April 29th through the May 3rd. People are coming that Sunday ahead of time. And you can register now. And in fact, the early bird rate is still available till Friday. And you can see content on the website. And if you go onto our website, you can click on the registration process. And you can click on the session button, and also can book your hotel as part of the registration process. We're real excited about the content this year, and we've had a lot of great sessions proposed, really hoping to improve the professional development of Head Start grantees throughout the country. And as you can see, there are going to be some more scholarships and awards this year, and we're excited and just thrilled about the great work that people are doing across the country. So again, love it if you all register, and we hope to have a great turnout as usual in San Antonio. And as you can see, here's the agenda. I'm going to talk about a few of our key federal updates, funding, some authorizing legislation, and the pitch for Head Start Unity. And then I'm going to talk a bit about what is going on with our work in states, and support of state and regional Head Start associations to really help support Head Start, advanced Head Start, and early Head Start in these contexts, both to equip state and regional Head Start leaders as they navigate early childhood policies in their states, and also to try to inform and improve state-level policymaking and decision-making, so it provides Head Start with an important role and important recognition. So you can see these are the areas that in the center of the states I'll be covering, which are informational support, state and regional Head Start associations, policy assistance, including legislative assistance, tracking of legislation, and also advancing, as I just said, Head Start in state and local early childhood systems. To start with, we're going to talk a little bit about the federal update. A lot happening. It's appropriation season in DC. And some of you may know that yesterday, President Trump released his budget. And by the way, I'm going to take questions after we do the federal, and then I'll go into the state stuff. We'll do questions after that too. I meant to mention that. But the president's proposal came out yesterday, and it's important to realize that the spending process can be a little complicated federally. The president's budget is just a proposal, and it certainly has some impact, depends on the context, but Congress will decide its own bills. And especially with the Democrats in the majority in the House, the president's proposal will very likely be altered as Congress goes through the process. But for Head Start, to start with, the president is proposing even funding, flat funding at $9.3 billion, I think it is, and also flat funding for the Child Care and Development Block Grant, both of which CCDBG has received a huge increase in the past 2 fiscal years, nearly doubled in the past 2 fiscal years, and the bulk of that coming 2 fiscal years ago, meaning fiscal year 18. And the president is proposing level funding. While the increase has been very critical to child care support, it has not been, still not enough, even close to enough to serve unmet need and fulfill the state's responsibilities and local programs' responsibilities in adhering to the high quality standards set forth in this federal reauthorization of CCDBG a few years ago. Head Start, as you all know, received some increases, some excellent increases in the past couple fiscal years, and so we'll see if Congress will be able to increase that, and we'll talk in a minute about what we're proposing. The budget, president's budget, does propose to eliminate some other related programs, literally zero them out, as including the preschool development grants. I know California and Arizona, all the states in Region 9, I think, got PDGs. And he's also proposing to eliminate the Community Services Block Grant, which provides funding for CAP programs, critical to Head Start, and also LIHEAP, which is a critical support as well to Head Start and low-income families, the Low-Income Heating Energy Assistance Program. So these are some concerns that advocates for low-income families and people have expressed, and also early childhood advocates have been concerned with it as well. The president is proposing a one-time $1 billion increase in mandatory funds for child care for underserved populations and to stimulate employer investment. We've not had a chance to talk about this internally yet, but what I read, and I haven't seen the details, but from what I read from national early childhood advocates, such as the National Women's Law Center and the Center for Law and Social Policy, this proposal is conditioned on states eliminating or removing what's called unnecessary regulations. And what the advocates are saying is that means health and safety and quality protections. So they're not enthused about it. And as I said, we have not had any discussions even internally yet about this, fresh off the presses as of a day ago. But if you see this proposal, there are some concerns about it with the child care money. Turning over to the appropriations, the National Head Start Association recommends a significant increase in Head Start funding in fiscal year 2020, which is a slight bit over $1 billion increase, $1.05 billion, which would raise the overall amount of Head Start funding from $10.06 billion to $11.11 billion. And there's a $9.4 billion base that we expect in Head Start. That's what I was referring to before. I think the total is 10, a little over 10. But the base we expect will be $9.4 billion, and that we are advocating for continued funding, level funding for early Head Start expansion, which includes the early Head Start childcare partnerships, and that would be what we want is a continuation of $805 million per year in fiscal 20. And in addition, we are proposing a $1 billion increase for 2 main purposes. One is a COLA, cost of living adjustment, and another, which is the bulk of the request, is for a quality improvement fund. The COLA would be $191 million of this proposed increase, or about 20% of it, and it would result in a 2% cost of living raise. The rest of the increase is $900 million, so it's a little bit over, we're requesting a little bit over $1 billion. The $900 million includes 2 main sections. One is the larger amount is $745 million in trauma-informed practices. And most of this, about 2/3 of it, $557 million of it, would be for third classroom teacher in every Head Start classroom to really help with some of the difficulties and behavioral issues and really difficulties that children are facing in whether it's in their home or in their community. So some of this includes substance use disorder and other kinds of trauma that children and families are facing. We also, as part of this trauma-informed proposal, are looking at mental health consultation, which would be about $161 million of the money, and also staff training, which would be about $26.5 million of it. The rest of the increase would go for program improvement, and we're proposing a $155 million increase for activities such as staff training, facilities, duration, coordination, and transportation safety. So that's what we're proposing, and we are also engaging the Congress with support of a couple of letters in the House of Representatives that are pushing for Head Start funding. And every year, Congress, as they're considering increases and different spending levels, some programs that are really popular, like Head Start, a member will write what's called a Dear Colleague letter, send it to his or her fellow members, encouraging them to sign the letter so that the appropriators, and then they send it to the Appropriations Committee, and the appropriators can see how many members support these programs. And for Head Start's letter, there is a letter being written by Congresswoman Catherine Clark of Massachusetts, and she is giving her letters, including our proposed increase, the NHSA recommended levels, and that is just started to be circulated. I think the deadline is the week after next. And it's mostly a Democratic letter, and then there's going to be a Republican letter by Congressman Steve Stivers of Ohio. And that letter will not have a funding amount, and this is similar to what happened last year. And what we really want to do with that is make sure that members of both parties feel comfortable about requesting an increase. So that's what they're going to be doing. Certainly, members can cross over and sign the other one, but we also want to make sure that that if a member is not comfortable committing to a particular amount, they can sign the Stivers letter. If they are, they can sign the Clark letter. And so that's going out the letter. In the Senate, there's not going to be a specific Head Start letter, though Senator Bob Casey of Pennsylvania is sending around a Dear Colleague letter for a range of early childhood programs, including Head Start, and that will be circulating in the Senate. I think it already is. Turning to some authorizing priorities pretty quickly here is to start with, there's a couple of bills that are related to early childhood, including Head Start. The big early childhood bill was introduced by the chair of the House Education and Labor Committee, Congressman Bobby Scott of Virginia, and the ranking member of the Senate Health, Education, Labor, and Pensions Health Committee in the Senate, Senator Patty Murray of Washington. And this bill is called the Child Care for Working Families Act. It is a Democratic-only bill. No Republicans are on it yet. And it has a lot of supports for low-income families for child care, including an entitlement for child care of 150% of families at 150% of the federal poverty level or below, a maximum 7% copay with exemptions for very poor families, pay parity between early childhood teachers and K-12 teachers, a cost estimation model, which when I was in the House, we put that in the Child Care Development Block Grant reauthorization. That will really help states determine what the cost of quality care is. And there's some increases in supply of child care in underserved areas. There's some provisions on Head Start in there, including support for increased duration. That's the big part of that. And also some allowable use for the Quality Improvement Fund. And Tommy Sheridan, who's our Senior Director of Government Affairs, was working with both staff of both committees to trying to influence those provisions and make sure that we could get some quality money in Head Start as well. There's another bill by Senator Warren that's being developed, also a child care entitlement bill. And I don't think it's been introduced yet, but you might have seen it's a universal child care bill. It got a lot of press, but I don't think the bill has been out yet. There's a early childhood facilities bill as well by Congresswoman Bustos of Illinois and Senator Tina Smith of Minnesota. And this would create community development financing initiatives for early childhood programs and states to take advantage of to build facilities and expand them. Head Start would be included in that. And then last on here is that we are preparing for reauthorization. We don't know when that would be. Right now, we do not think right now is a good time for that for a variety of reasons. One is that we're concerned that a proposal with this administration, that a reauthorization proposal could get tainted with calls for immigration limitations and also potentially work requirements. So we really want to do this at the right time. When it does, we've had some great conversations with state and regional association leaders, and the big areas we're focusing on are include looking at eligibility changes potentially, maybe a little more flexibility on eligibility, maybe also some greater supports for workforce, and then looking at the Head Start collaboration offices and early child advisory councils to ensure that Head Start is properly represented in their actual meetings that occur for these advisory councils that include Head Start's voice, and that there be some good federal enforcement of some of these provisions, because we've seen that be a bit lax. So the last point I'm going to make here about the federal update is that there are a lot of, as you know, a lot of candidates running for president, and many of them are prioritizing early childhood, child care, pre-K. And I think some of you may have seen Yasmina's note a couple weeks ago that it's really important. We're saying it's really important for Head Start associations at the state and regional levels to not back a particular candidate for president and to remain bipartisan. We're just urging that. We certainly don't want Head Start to be seen as playing favorites, and in the future it could jeopardize possible funding at the congressional level. So we just wanted everyone to keep that in mind as this presidential race gets heated up. So I want to stop here and see if people have questions on the federal issues.
Yep, so I've gone ahead and unmuted each of you so we can so you can ask questions directly, or if you choose, you can mute yourself again. Questions for Scott?
I don't have any questions at this point. It's quite a lot to absorb.
Yeah, there's a ton going on right now.
There really is, and to add then the state pieces as well that are, just even more. It's quite a bit, but exciting.
Yeah. Mm-hmm.
Hi, this is Tiffany.
Scott,
no, I don't have any questions. Scott, that was an amazing update. Thank you so much for sharing all that information. I think the one thing that you said towards the end that the fact that you have to say it was, oh, we're hoping that associations aren't backing any candidates is scary, because I hope that's not happening, right?
Yes.
But yeah, I mean, overwhelming amount of information, and there is a lot happening. So thank you for the update.
Sure. I was hoping not to overwhelm you, but there is a lot of information. We really want to update you all.
Scott, I do have a question around the CSVG and LIHEAP elimination again. I actually hadn't heard that, and I know that that's been an ongoing issue over the years. What is your take on the likelihood of even that happening yet again this year?
I think it's a low likelihood. Tommy is really our expert on congressional relations and affairs, but from my years in working on the Hill, there's a lot of support for these programs, and the president's budget, especially in things when you're talking about eliminating these critical programs, I don't think Congress has a lot of appetite for it. I can't remember if there were cuts at all last year. Does anybody remember? I wish I knew.
No, there weren't. There have been steady small increases, like some discretionary funds, but basically it's been stable.
Yeah, I guess just my own, personally, I would probably predict that again.
Thank you.
Gladly. Yeah, because it's pretty extreme. We think it's pretty extreme for him to be proposing to eliminate these programs. You know, there's a political push here. The president really wants to try to generate as much money for the border wall, and you know, pulling money out of these critical programs can be very detrimental to low-income families.
And Scott, this is Ed. I would just maybe, I guess, add an observation, not so much a question, but it could be for follow-up as well. And that's on the facilities aspects, both in California and federally. The renewed interest in funding facilities is great. I think sometimes, though, the monies roll through programs that obligate agencies to loans. Community development and investment efforts often are loans, not grants. And for our agencies, taking loans is taking dollars away from teacher salaries. Agencies don't need loans, they need grants. They need to be able to operate facilities, not dip into other sources. I know some agencies do have to pay rents, but I don't know, Camilla or Cedric or Tiffany, you can comment on this, but I think we always want to keep the amount of facility costs to an absolute minimum, because it's just another operational cost that takes money away from some other part of the operation.
That's right. Well, here in California, since the State Department of Education took the grant, took the facility grant program away and made it into a loan program, nobody's using it for that very reason. Then it just takes away from the needs of the program. And since subsidized funding is so uncertain anyway, it's really not even possible to take loans. So here in California, as you know, Ed, there's some legislation around facility funds in the form of grants.
Yeah. Well, that's great to hear. Really appreciate your perspectives on this, and I'm going to bring this back to Tommy. He's been tracking the Bustos-Smith legislation much more closely than I have, and see if there are grant opportunities in there too, and we can bring your feedback to the sponsors as the bill moves forward, if it does.
Should we move on, Scott?
Sure, glad to. If you would go to the next slide, that'd be great. Just to set on the stage here at the NHSA, as you can see, this is kind of our motto, is just that we cultivate and support and disseminate innovations and best practices of state-based early learning systems. And this certainly includes support to regional associations, which several of which, including Region 9, have been very active in helping us support the work of NHSA in many ways. So once again, thank you. And thank you also for having me on today and to share this information, have this dialogue. And the next slide is a description of the types of information requests, support that we give to state and regional Head Start associations. And to start with, the types of support include these monthly water cooler webinars we have at the end of the month. And we also have monthly workshop calls for our members, and responding to information requests. This time of year, January, well through March really, are the big months when state legislatures are in session. That's when we get a lot of requests, information requests from states. And a lot of it has to do with bills before their legislature. And you know, we've gotten questions about QRIS and where Head Start fits, questions about, you know, how is Head Start working with state pre-K on facilities, just what we were talking about. What's some research on the efficacy of early Head Start? You know, how are states forming their early child advisory councils? Things like data integration, voter registration. How are they implementing certain parts of ESSA? And so it really does range across the board, and much of it is related to state legislation. And then our regular listserv updates. So we'll send out a whole bunch of materials over our listservs and just really try to educate and update our members. And so the types of information, federal actions updates such as the one I just gave, and effective practices, issues like the Year of Whole Health, vision screening and hearing, issues related to homelessness and serving those kinds of vulnerable populations in Head Start, things related to DRS and some of the changes that the department's proposing. And then research studies, such as there was one recently that came out really debunking these myths about Head Start not working, the Learning Policy Institute, called Untangling the Evidence. And it backed up a lot of what we've been saying about some of these studies that just say, oh, Head Start fades away. Well, that's really not true. That, the K-12 system has a lot to do with what happens to children by grade 3. And this report is an exhaustive research lit review kind of, and it was really helpful. Another one that just came out is from the Bellwether Education Partners called Exemplars, and that publication highlighted several Head Start programs around the country, including Acelero, and highlighted not just that they are quality and effective, but why they are. And NHSA has been helping Bellwether over the past week disseminate this and really promote this great publication. And then recently the State of Babies Yearbook was released by the 0 to 3 and Child Trends, identifying gaps in infant and toddler care, and also noting really ranking states on how well they're serving infants and toddlers across the board, early childhood, health, family support, all that. And then things like the State of Preschool Yearbook, which comes out in probably about a month, that also rates states in terms of how well they meet early childhood standards. And then original research, we make sure to put that out as well. Things like studies on foster care and Head Start's impact on foster care placement and intergenerational poverty and school funding effects on Head Start. So there's a lot of that out there. We really want to update our constituents on that. So, and then issues like publications and meetings and activities. So put that out there as well. State legislation and funding proposals. We track this policies and legislation, and we also provide technical assistance on specific bills and laws, and also provide technical assistance to Head Start associations when they are communicating or negotiating with state agencies or the governor's office. And then we provide a lot of updates, information about state appropriations, and also work with Head Start associations in mobilizing and galvanizing parents to advocate for public policy changes. So those are some of the areas that we are working on with state and regional associations. This is just a snapshot of some trends we've seen. I shared this on the water cooler the other day that we're seeing in states and in our tracking. First, the expansion and creation of state preschool programs. A lot of proposals of universal pre-K. A lot of new governors came in the 2018 elections calling for universal pre-K, and we see legislatures across the country working on this. And then other states, including we're seeing in Hawaii is looking for some increases. Mississippi is, I think, approving some increases. And I know you mentioned before about facilities in California. I think there's maybe some interest in budgetary increases in California with Governor Newsom in there. Montana is looking at proposing preschool expansion of their preschool program, which right now is just a pilot. Idaho, which doesn't have a preschool program, tried to introduce a preschool bill this year, and it got shot down. They wouldn't even let them introduce it in the Idaho legislature. The other side of that, you have states like Illinois, Colorado, some others, where the governors come in and said, we want universal preschool, whether that's this year or in the future years. So we're excited, to see that. And we really want to make sure that Head Start is respected when state pre-K expansion occurs. And then, eligibility expansions for Head Start or similar programs. We're seeing that in quite a few states. Washington State is looking to expand categorical and age eligibility for their early childhood assistance program. And other states are focusing on allowing pre-K dollars to flow to Head Start, like in North Dakota and in Rhode Island. And then there's quite a few bills about state agency authority over early childhood. I think Hawaii is going through this. I'd like to hear your perspective here, but I saw an article about this recently about whether it should be in the Department of Ed or in the early childhood agency. In Louisiana, the Department of Ed has kind of had a huge influence over all early childhood programs, and there's concern in the Head Start community that Head Start is being kind of overrun, their recruitment and enrollment processes. In Virginia, there was also a bill to move all early childhood into the Department of Ed. It was very academic focused, very school readiness focused, and really left behind the important issues of social emotional learning and some of the comprehensive services. And the Virginia Head Start, we worked with them to help them articulate this to some of the bill sponsors, and that bill was shelved because there was a big outcry about that. And so we helped them work on that. And you know, other things like the Early Child Advisory Council in South Dakota was rejected again for several years in a row now. Early Head Start programs, you know, Washington State is trying to push that. Maybe in California, I'm not sure if there's been some, I thought I saw a couple pieces of legislation on early Head Start or infant toddler. But and then quality improvements, go ahead, sorry. Anyway, the quality is another important one. And in Florida, there's been a universal preschool program there, but it's widely known to have very poor quality. And so we've been working with our parent advocates out there to connect with the early childhood advocates because it's been really poor quality, and there's a big effort there with a lot of the mayors of Florida pushing the legislature to invest in quality preschool, which we know is what produces good results. And then Head Start supplemental funding of states. We have a grant from Voices for Healthy Kids and the American Heart Association to really promote this. And some of the states that we're not even working with are doing this. We're seeing proposals in Massachusetts and Pennsylvania to expand their amounts. And you can see the amounts here from a couple years ago. And these have already been increased in fiscal year 18. And there's some proposals for fiscal year 19 as well to increase these amounts. And we heard in Alaska there might be some cuts. The governor is proposing major cuts throughout the education system, and unfortunately that would include Head Start. So trying to get a sense of whether that'll happen or not in Alaska. And then the next slide, please. The next part of our supports to Head Start associations in states and regions is advancing Head Start in state and local systems. And you know what we mean by that is really ensuring that Head Start has opportunities to access resources and is at the table in key decisions that affect them, and is coordinated with by state agencies and programs in terms of services, funding, standards, and availability. And you can see these are some examples that we've really been plugging Head Start associations into and ourselves, that the preschool development grants, which are explicitly about mixed delivery systems, and the law names Head Start throughout it. In some states, most states have been fantastic coordination between state Head Start associations, the Head Start collab offices, and the state agencies working on the grant. But in some cases, and they've worked on it together to look at this together. But in other cases, it's not been as good, and we've worked hard to connect with the Head Start community in these states and really encourage them to work with the state agencies. And we've talked to state agencies about working with Head Start associations and to make sure that Head Start is part of this big expansion in planning and for preschool programs. In addition, I'm involved in the Council of Chief State School Officers High Quality Pre-K Network, which are departments of education in each state planning their expansions and coordination of early childhood. And so by having me as part of that network, I'm able to ask about and promote the Head Start voice and really help them connect with their Head Start partners. And then coordination agreements, the Every Student Succeeds Act added some provisions in the ESEA reauthorization a couple of years ago that require local educational agencies to coordinate with Head Start, form agreements with Head Start and other early childhood programs. So I was out in Indiana helping them with this, and been working with some other states too, to try to, Ohio and others, really working to ensure this is happening. We found some great examples here in DC and Maryland, Indiana, Virginia, Utah, and quite a few states that have really stepped up, North Carolina, to train their school districts to work with Head Start and coordinate with them on staff training and parent engagement and educational services and record sharing, all that. So we put a toolkit out, and we're really trying to encourage that as well. And then other ESSA opportunities, things like, you know, PDG, the joint professional development, Title I use of for preschool, which has to use the Head Start standards. And then lastly, the Chamber of Commerce nationally and in local communities throughout the country have been promoting childcare and early child education as a critical element to supporting the workforce of today and tomorrow. And in each of those cases, when they do big events in cities, we're out there encouraging our Head Start, local and state Head Start partners to be engaged in these conversations.
So Scott, I'm going to just hold you for a moment at that. Please. And just open up if there's some questions. I know we're at about 45 minutes to the hour, so I want to unmute people's lines and just make sure if there's any questions with the last bit of information around the states and points that Scott has made to ask those questions, and that way we'll keep up with you, because you are giving us lots of good details on what's happening in your work zone as well as what's happening around the country. Questions?
No questions.
Let me, thank you. And I wanted to ask just one on behalf of, I think, Arizona, Hawaii, and Nevada. Scott, you're available if Tiffany, for example, who's on the line, wanted to bring you into one of her board meetings. You're available to jump on the phone and do this very sort of breakdown of what you hear coming out of their states and adjoining states. You've got that intelligence, and time is available for you to do that. Isn't that true?
Yes, yes, it certainly is, and we're glad to. Sometimes Tommy does them, and sometimes I do. It just depends, but we absolutely are glad to do that.
Yeah, because one of the interesting things with a state like California, though, the board meetings for the state are a select number of grantees, such as Camilla, but you get into Arizona, Nevada, and Hawaii, those board meetings are all the grantees in the state. So that board meeting also serves the purpose of really organizing. So it's great for Tiffany to put you on the agenda, and that way you can reach directly into the state if time's available. Just as a thought, and I'll promote that out to Arizona, and Cedric, you can carry that to Ben as well in Hawaii as a resource.
Ed, this is Tiffany. That is pretty awesome that you just brought that up. We have been talking about how do we sort of increase our capacity at the state level and making sure that we get all of the information, and have invited our regional reps from the Office of Head Start to our next face-to-face in April. And so wouldn't it be amazing if we started out our meeting with sort of these national updates this same way? And so I appreciate that. Thank you.
You sure?
And as you think about it, Tiffany, you're more like Idaho and New Mexico than you are like California in size. And so, the regional boundaries sometimes, it's great for you to hear from someone who can look at that Western states approach that Nevada, Idaho, Montana are taking. That might be informative.
Very much so. We try to pair states similar to each other with each other. We can do things like this over the phone. Sometimes if a state association wants to pay for one of us to travel out there, we'll do that. As I said, in Indiana and Washington, and Tommy does it quite a bit throughout the country. So
great. So Scott, we've got about 5 minutes to go. If you want to, I know you have a couple more slides.
Yeah, and I can be real quick within that 5 minutes. want to say these are state units of government. NHSA, has found that there are some of these organizations that push for state control over everything have been pushing for state control over Head Start, which has be a very damaging activity, very damaging policy. And NGA and NCSL have both made statements. NGA made a statement, and NCSL, the National Conference of State Legislatures, wrote a policy resolution, both pushing for state control over Head Start. And NGA was more broad, early childhood in general. And we've confronted them and also tried to work with them, kind of the carrot and the stick. We've said this is not good, but we also want to help educate your members. And we've helped mobilize, we've reached out to them, worked on some joint efforts with them, helped mobilize the Head Start community nationally to connect with state legislators, for example. And another group, Education Commission of the States, they're a great resource on information. They had as their president the governor of Mississippi, Phil Bryant, and he was going around, the country kind of criticizing Head Start and saying it didn't work. And also internally was talking about wanting to take over Head Start. So we did a lot of monitoring of his comments and expressing concern about that. And I mentioned CCSSO before, the pre-K network. They're a great partner, but their former president was the superintendent of instruction also of Mississippi, and she was mischaracterizing Head Start data and saying it didn't work. The data showed it didn't work, which is also not true. That the best growth, one of the best growth of any program. So we had to, again, confront her with that data. We worked with our Head Start Association there in Mississippi to confront her with some of this data. I think she's backed off a bit. And then, so really empowering our groups, our associations with these states when they get a little bit hostile toward Head Start. The LUG, and this is just a list of things where we can really work with states. And we've pointed this out to NCSL, that states need Head Start. Head Start adds to quality in states, whether it's standards or QRS, system leadership, funding, working together on funding, helping implement ESSA in a way that includes all early childhood programs, including Head Start, and the work of the collab offices and the early childhood councils. And then the opposite is really the local units of government, which tend to be our natural allies and friends, partners, National League of Cities, Association of Counties, Conference of Mayors, School District Superintendents, and National Association of School Boards. They, like us, want local control over early childhood programs, and we've worked with them to strengthen their policies to clarify their support to Congress of federal to local Head Start funding and administration. So NACO, the National Association of Counties, National League of Cities, they have specifically strengthened their language about this and said we want to make sure very clearly Head Start remains federal to local. So here's my contact info, and would love to have any more questions about this. How we can support you and other regional associations and state associations.
And I'm going to, Scott, I'm going to unmute. Yep, please go ahead.
I don't remember where I heard this information and just wondered if I was dreaming or if it was real. Is National Head Start Association sort of putting together something, I don't know, around DRS and specifically around active supervision? Does that sound familiar?
Active supervision, can you say
sort
that?
Of like findings and deficiencies, like not laying out the same sort of consequence for active supervision issues. And there was something else, but I just heard a rumbling about it and I didn't have enough information. I don't have enough information to sort of say anything more than I feel like I heard a rumor. That National Head Start Association was trying to put something together to say, hey, Office of Head Start, DRS, let's not lay out the same sort of consequences for everyone that has active supervision deficiencies or something like that. That sounds like.
It does. It's Tiffany, right?
Yes.
Yes. You did not dream it. that about a year ago, a little longer than that, I think it was December, January of 18, HHS sent out a request for comments on potential changes to DRS. And you're right, NHSA worked extensively to develop a big set of recommendations on DRS, which would, instead of just saying if a program had some deficiencies or didn't necessarily meet the thresholds for proficiency in the 3 categories of class, that they wouldn't necessarily just be recompeted, that they would get to be, depending on how low their scores were, they could be put into what we call a quality improvement zone, where it would give Head Start programs a chance to do better, to improve, and if their scores on the next time around were better, then they would be taken out of the recompetition. But instead of just saying win, lose, like you're fine or you must be recompeted, to help, instead of just being that stick, to really help Head Start programs meet high quality and get to that point. And so that was one of our proposals. And I think we had some language in there about the supervision issues of someone, there was a child left on a bus, for example. Yeah, that's obviously not good, but does that mean automatically that deficiency should automatically lead to recompetition? Just really questioning some of the blunt instrument used by that system. And I think, it's been 12 years since that system was developed, or 11 years, I guess. And we thought it was time for them to reevaluate that. The frustration is that they have not responded at all publicly in now about a year, and we just recently sent them a letter encouraging them to get with it, to get on it. So what are the changes you're looking at, and to let programs know what they're thinking.
So, excellent. Well, thank you, Scott, and thank you, Tiffany, for that great question to kind of bring us to a close. I'm going to go ahead and make sure that we share out this recording that we've made today of the presentation, as well as your contact information in general to the Region 9 community, and specifically to state presidents, so that they can make arrangements as their schedules fit to bring you in and hear from you on issues that are burning in their states and areas where they need support. So again, thanks, Scott, for your work, and thanks for the work of all those at NHSA. And just to remind everyone, the work of NHSA doesn't come about through grants or through gifts. It comes about through donations and membership dues from the organizations in Region 9 and across the country. So we strongly encourage you to become a member of NHSA, as well as raise dollars for Dollar per Child and attend the national conference to make that donation in person or through the mail, whichever works best for you. So thank you very much. Scott, hold on just a moment.
Thank you for having me, and appreciate it. Appreciate all your support.